हो, 1-2 मिनटं. माझा अजून का आज येते. अजून तसाही वेळ आहे ना, 3ला 54 झालेत ना आता. किती झाले? कधी बघतच नाही. तो स्टुडंट्स इन द लिस्ट ऑफ Students, in the list of non-communicable diseases, today we are going to discuss injuries and accidents. दिसता का सर slide? Injuries and accidents, this is the today's topic. Now, specific instructional objectives of this topic are, first is different definitions, second is different types of injuries. Mainly they are divided into intentional injuries and non-intentional injuries, or unintentional injuries, and non-intentional injuries or unintentional injuries are also called accidents. Intentional injuries, about that we will discuss first. Magnitude of problem of injuries and accidents at the world level, at developed and developing countries level, at India level, classification of the injuries and prevention and control. This is how we are going to discuss today's topic. In a definition, it is a damage caused to the health of life of a person resulting from an acute transfer of energy, which may be mechanical, thermal, electrical, chemical or radiational to human host, which causes disease, disability or death. That is the definition of injuries. Injuries are subdivided into intentional injuries and unintentional injuries or non-intentional injuries. Non-intentional or unintentional injuries are also called as, they are accidents. Unintentional injuries or accidents are unmeditated, unintentional, unplanned occurrences involving transfer of energy from an environment to the human beings, either directly or through a vector, leading to illness, disability or death of a human being. For community medicine and public health persons, the term unintentional injuries and accidents are synonymous. Or regarding the magnitude of problem, 5.8 million people die each year due to injuries all over the world. It accounts for world's total 10% of all the deaths. The 3 leading causes of death due to injuries are road traffic accidents, leading to 5%, which is the 5th leading cause of death. Homicides, 12th leading cause of death, and suicides for 18th leading cause of death. As far as India is concerned, ICMR and PHFL, their report suggests that 10.7% of all the deaths in India are due to injuries. Out of 10 million deaths, 1 million are likely to be as a result of injuries. In 2015 data, it says that there are total 4.13 lakh deaths due to accidents, and in that, road accidents causing deaths are 1.77 lakhs, suicides causing deaths are 1.33 lakhs, and road injuries causing deaths or injuries are 3 lakh persons getting seriously injured or disabled every year. So this is the magnitude of problem as far as India is concerned. Regarding accidents, accident is defined as unexpected, unplanned occurrence which may involve a injury. WHO in 1956 defined unpremeditated event resulting in recognizable damage. Occurrence in a sequence of events which usually produces unintended injury, death or property damage. Accidents represent a major epidemic of non-communicable diseases in the present century. They are no longer considered as accidental, means they can be prevented also. They are a part of price we are paying for technological progress. Now, characteristics of these accidents: for any condition, agent, host and environment, they interact together to produce the result what we see, that is a form of accident. It can be in the form of injury or it can be damage. They occur frequently in a certain age group. It has been observed that certain people, they are more prone for accident, what we call it as accident prone personality. Then secondly, at certain time of the day and week, when the maximum rush is there, the chances of accidents are more. Then at certain localities where the majority of the people stay, naturally on a road at a given time, the number of people travelling are too many, and so they meet with an accident because of not following the rules of traffic. Certain people are more prone to accidents than others. That's what I said. There are some people who are accident prone personality. They are those who are timid. Secondly, those who are having stress and strain in the life. Number 3, they are always feared in the mind when they are travelling. They are not very confident, and sometimes they don't know the rules and regulations of driving, and so in such situations, what is to be done about that he doesn't know, or sometimes the vehicle does not support, and that is why such people are more prone for accidents. Susceptibility increases with consumption of alcohol and other drugs. Under the influence of any drug, naturally the reflexes are not as per the expectations many of the times, and so person meets with an accident. Then also physiological state, like fatigue. Person is fatigued all the times, he was very much busy, and now he started driving, and naturally because of the fatigue condition he met with an accident. Major accidents are preventable. Then mortality, morbidity of the accidents. It is measured by proportional mortality rate, that is out of total deaths, how many deaths are occurring because of accidents. Their number is 100 per 1000 total deaths. So 10% of the deaths are occurring. Proportionally 10% of the deaths are occurring because of accidents. Then those who died within 30 days after the accident, as a result of accident, they are included in the list of cause of death as accidents. Then death rate per 1000 registered vehicles per year. That is also one way of classifying it. Out of total vehicles that are being on road, how many deaths are occurring per 1000 registered vehicles per year. And number of accidents or fatalities as a ratio of number of vehicles per kilometer. That is another way of classifying the accidents. Then death of vehicle occupants per 1000 vehicles per year. Morbidity is classified as serious injuries, slight injuries and abbreviated injuries. This is also the classification of morbidities is done. Now disability due to accident. Disability after the accident, it can be temporary or permanent, it can be partial or total. It does not take into consideration the psychological or social aspects of accident or injury. Here in disability, only physical disability is considered. The International Classification of Functioning Disability and Health, that is ICF, is an attempt by WHO to estimate disability of individual at a given moment. Now injuries, unintentional injuries, road traffic injuries, poisoning, falls, fires and burns, injuries, drowning, exposure to mechanical forces and natural disasters, all of this they come under unintentional injuries. And intentional injuries are interpersonal violence, that is homicide, sexual assault, neglect and abandonment and other maltreatment, suicides and collective violence like war. This is how the classification of intentional and unintentional injuries is being done. Now, it has been observed that some children and some adults are more prone or more vulnerable to certain type of injuries. As per the Sustainable Development Goal data, which was published in April 2018, when the statistical data is compared with the global data and Indian data are compared regarding deaths in natural disasters, homicides, major conflicts, poisoning and road traffic accidents, the number of people dying in India are comparatively less than that of the global figures. But only in case of suicides, the number of deaths due to suicides in India are more than that of the global figure. So this is a very much concern point regarding Indians, and they should take care of not to indulge into such type of activity. About intentional injuries, when a predetermined intention existed on the part of another person or a group of persons to cause injury to the person who has been injured, that is intentional injury. Classification. These intentional injuries are classified as: number one is self-directed violence, that is act of suicide or attempt of suicide. Then second is interpersonal violence, that is violence between two persons or two groups which may end fatally, that is homicide or non-fatally. And third is domestic family violence, that is special type of interpersonal violence of 3 types. Now they are: number one is child violence, second is intimate partner violence, which can be in a couple, husband and wife, or elderly directed violence. Elderly are asking to go ahead and do this, continue this violence, such type of activity. Now collective violence is committed by large group in a communal and socio-political conflicts of violent nature. Then armed conflicts, that is which occurs during wars and war-like situations where many people are carrying out this activity, or resulting in death and injuries of military personnel or civilians in war-like zone, acts of maybe in an act of terrorism, and this is increasing in time and space nowadays. How this can be prevented? For prevention and control, preventive steps at individual level, at family level, at community level. At individual level, it is program against drug abuse. If anybody is involved in drug abuse, then there should be some program run. Secondly, school-based program to prevent child maltreatment. Then community-based prevention of child sexual abuse. Treatment for child and intimate partner abuse offenders. This is to be done at individual level. Now, preventive steps at family level are psychosocial counseling at family level. Second is program to strengthen ties within the families, and programs to strengthen emotional and social ties at workplace. Now, preventive steps at community level are improvement in medical emergency response and trauma care, providing secure means of transportation of children to and from schools, educational campaign to increase awareness of child maltreatment, developing healthcare professionals trained in identification and referral of victims of sexual violence. Then development of strict laws for people indulging in intimate partner violence, child abuse and elder abuse. Then disruption of illegal weapons, trade and substances which can cause poisoning, and coordinated community intervention and educational campaign against interpersonal violence. Now, preventive steps at societal level for preventing this intentional injuries are reducing violence content of movies, TV, video games and internet sites through suitable laws and their enforcement, so that this violent action will be reduced. Then launching public information campaigns to promote pro-social norms, strengthening of police and strengthening of judicial system. Then creating job opportunities. Many of the times it happens that because youth is free, jobless, so they are unnecessarily getting involved in this type of intentional injuries. So creating job opportunities for youth and introducing poverty alleviation methods. Then national and international action for reducing armed conflicts and wars. Then strict laws and their enforcement along with international measures to tackle terrorism. Now about unintentional injuries or accidents. 2/3 of the deaths due to injuries are due to accidents. These accidents are classified as domestic accidents, in which burns, falls, electrical injuries, then accidental poisoning takes place, which leads to accidents. Then second type are injuries while traveling on road, that is road traffic accidents, RTA, air crashes, railway accidents, drowning due to boat or ship accidents leading to injury, disability or deaths. And third type are injuries at workplace, that is occupational accidents and injuries. Then accidents at the places of worship, maybe mandir, masjid or church, or at recreation places, maybe cinema theatres. Then injuries due to stampede, burns and drowning. Then falls and sports injuries. Then accidents due to disasters like earthquake, floods, cyclones, like these are the natural disasters, and leak of nuclear material from reactors, either intentionally or unintentionally. Epidemiology. In the epidemiology of these accidents, agent, host and environment. Now about agent. Agent can be a mechanical, thermal, chemical or electrical energy that is transferred to the recipient or human host. Now who is a host? Host is a human who manifests the symptoms of injury on receiving the impact of energy. The intrinsic factor are, number one is age, second is pre-existing medical condition, increases the risk of injury. Then fatigue, alcohol use, use of protective devices or education to avoid potential injury causing situation. The model of agent, host, vector and vehicle environment is utilized in Haddon's matrix to explain the causation and prevention of road traffic accidents. Regarding environment, the place where the energy is transmitted to a host is influenced by physical, social, demographic and cultural factors which can be modified to reduce the potential for energy transfer. For that, example can be taken that of road traffic accidents, construction of good roads, provision of street lights, efficient traffic policing are physical and social factors which can reduce the chances of transfer of mechanical energy from the automobile to a susceptible human being and thus preventing the road traffic accidents. Road factors, in that road construction, poor lights on road, are becoming an important risk factor for road traffic accidents. Poor traffic planning and management are the risk factors in road traffic accidents. Climatic factors, that is poor natural visibility, rainy season, and increased slipperiness, especially in rainy season of roads. So, road users should be extra vigilant, extra cautious regarding their safety. Then socio-environmental factors, the community, government, lawmakers, law enforcers are providing road safety and enforcement of safety rules, and these safety rules are construction of adequate roads and their adequate maintenance, proper and strict driving licensing procedures, enforcement of traffic rules and personal protective measures such as use of helmet by the two-wheelers and use of seat belt by the four-wheelers should be made mandatory or compulsory by law. Then provision of proper pedestrian walkways or overbridges for pedestrians. Enforcement of law related to drunken driving. Enforcement of laws related to overspeeding and enforcement of streamlining the traffic, especially for not allowing the pedestrians, light traffic and heavy traffic to mix up. Then quick legal procedures and stringent laws which would be seen as a deterrent to those indulging in non-compliance with the law. Regarding the vehicles or vectors, they are intermediary in transfer of energy from the agent to the host. Now for prevention and control of road traffic accidents, primary prevention is education, engineering and enforcement. Injury surveillance system. Second is education. Education and motivation of individuals, community members, political leaders and governmental officials as regards, number one is importance of proper licensing and need for strict policy for giving driving license should be stressed so that the prospective driver is adequately medically examined to determine regarding his age, strict examination of his driving abilities, and then only he should be allowed to drive a vehicle on road. Then prohibiting young people from driving in India. The legal age for obtaining permanent license is 18 years. So before the age of 18 years, nobody should be allowed to drive. Then not overspeeding, as it is the most important risk factor for road traffic accidents. So for that the speed limit should be 40 to 45 kilometers for four-wheelers and 30 to 35 kilometers for two-wheelers. Next is not driving after consumption of alcohol, as even the small amount of alcohol is enough to compromise with the reflexes, and there is nothing like safe driving in India. The legal limit for presence of alcohol in blood during driving is 30 milligrams per dl. Then not to use mobile phones while driving. Next is helmet use while using two-wheelers should be made mandatory. Then properly strapped, this helmet should be properly strapped to the chin and the seat belt when he is driving a four-wheeler. Take proper sleep before driving is to be done. Next is physical and mental exhaustion to be avoided before driving. Next to that will be sleepy and tired person should not drive. Then one should not drive after taking antihistaminics for common cold or allergic manifestations. Road safety measures, procedures and preventive measures should be a part of school or college curriculum. In school or college curriculum, every child or every person must be taught what are the traffic rules. which should be reinforced during the road safety weeks or during exhibitions. Then public should be educated regarding traffic rules. Then legal penalty if the rules are not followed. The vehicle should be checked for its serviceability before starting for driving regarding brakes, lights, horns and the pressure. Then engineering measures include construction and maintenance of roads, walkways and proper maintenance and construction of vehicles. Then good designing of a vehicle, error-free brakes, lights, horns, tires and seat belts are necessary. Then provision of pedestrians walkways in a manner that the wheeled vehicle will not encroach upon the walkways. Then provision of road dividers and adequate street light. Proper repair of damaged roads. Provision of adequate traffic signposting. Then speed breakers at vantage points. Zebra marking of speed breakers. Then reflective lights on highways, dividers on highways, enforcement of statutory provision of laws and bylaws and rules, and their strict enforcement agencies should be there. Then strict licensing laws and their enforcement to ensure that those below the legal age of driving should not drive, or not well trained in driving or suffering from health condition may adversely affect their driving capabilities and are not issued with a license. Enforcement of legal provision to prevent driving after consuming alcohol. Strict enforcement of traffic rules. Enforcement of regulations against overloading with passengers and luggage. Then quick judicial disposal and handling out of strict punishment to offenders, particularly those involved in accidents that have resulted in fatality or serious injuries, will send a stern message to offenders and inhibit others from disobeying the traffic rules. Enforcement of legal provisions for personal protective measures, especially helmets and seat belts. Traffic management to ensure that as far as possible, heavy traffic, light traffic, pedestrians and stray animals, they should not get mixed up in the same stream on the same road, otherwise chances of accidents are more. In India, Motor Vehicle Act 1988 was amended in the year 2017, which governs the motor vehicular traffic throughout the country. However, the implementation provisions are with state government. This act includes, number one is definition of various categories of motor vehicles. Second is tightening of the norms for drivers transporting dangerous or hazardous goods. Number three is it specifies the vehicle standards. The 2017 amendment have made the laws more strict to prevent drunken, rash or irresponsible driving. So this is how in primary prevention of road traffic accidents, if made mandatory, then definitely prevention of road traffic accidents is feasible. Secondary prevention, in that very early and efficient first aid and quick evacuation to a specialized health facility to deal with the cases of trauma and provide advanced life support and critical care in RTA, that is road traffic accidents. The concept of golden hour and platinum 10 have become widely accepted. What is this golden hour and what is this platinum 10? Golden hour is early management within 1 hour, and platinum 10 is first aid should be provided within 10 minutes following accident. A large proportion of mortality and serious morbidity can be avoided if these rules of golden hour and platinum 10 are followed. In military, this concept has come from military, and nowadays it is accepted all over, and it is very much useful in case of road traffic accident prevention. Cardiopulmonary resuscitation, intravenous fluids and pressure bandages to stop bleeding. Now, facilities required for transporting the patient. Transporting the patient in live condition in nearest medical center, and there should not be any delay. Basic life support and advanced life support, cardiac care, advanced life support ambulances are required for transporting patient where facilities for intubation and transport ventilation, cardiac defibrillator, transcutaneous cardiac pacing, etc. are made available. Role of ambulances in emergency services is very, very important. That should reach the site of a critical patient. Then on the spot, expert first aid for first respondent should be made available. Then timely transport to an appropriate healthcare facility. Then pre-hospital expert medical care and sustaining life till the patient reaches to appropriate healthcare facility. Advance intimation to a healthcare facility regarding the condition of the patient. From the public health and community medicine perspective, the essential requirements for ensuring the golden hour principles are: the capabilities of trauma care should be strengthened at primary level. These primary levels can be PHC or CHC. Advanced trauma care centers should be developed in each district where the victims can be quickly transported after the initial first aid is made available to him. Then organizing an efficient, specialized and quick evacuation system for quickly transporting the victims from the site of accident to the healthcare facility. A sociological climate should be created in which every citizen as well as police should feel free and responsible in first aid and quick evacuation of an accident victim to the hospital rather than being afraid of getting entangled in police cases and legal proceedings. The National Ambulance Service is the best system for it. NAS, National Public Sector Administered Referral Transport Service for injured under NHM with public-private partnership model is made available. For that, what is to be done? Dial 102 or 108 ambulance services. They function as centralized toll-free call from landline, mobile or STD booths from anywhere in the country. The call center will direct the nearest ambulance and the ambulance will reach at place. Objectives are to facilitate transport of other emergencies such as accidents, poisoning and other medical emergencies and ailments. And second objective is easy access to ambulance services for all. Dial 108 focuses on nationwide 24/7 integrated emergency services for saving the life, reporting a crime in progress or reporting a fire. Dial 108 focuses on emergency response for patients needing critical care such as accidents or trauma victims and burns victims. Now this 108 ambulance, the equipment that is made available in these ambulances are suction pump, laryngoscope, flow meter, oxygen cylinder, bag and mask ventilation device, then canvas stretcher folding, stethoscope, BP instrument aneroid, syringe pump, transport ventilators, then stethoscope, pneumatic splints, cervical collar, first aid box, spinal board, double immobilizers, fetal Doppler, portable glucometer, automated external defibrillator, monitor, IV cut down set and suture kit, pulse oximeter, automatic non-invasive BP, then supraglottic service, the device. These are made available so that the chances of on the way also the expert doctor can give services to the patient. Now next important thing is regarding triage, which is followed after every disaster. Now what is this triage? Triage is a French word, means to select or to separate. Today is integral part of every emergency medical services. This triage is followed. It is the process of allocating priority for emergency treatment to critically injured or ill patients when medical resources, that is manpower, equipment, medicines or even time is very limited. Then to whom to give priority? That prioritization is done according to the rules, and that rule, that is according to color coding in the triage. Now priority number 1 is given to color code red patients who require immediate surgery so that their life can be saved. The two examples I have given, they are a patient of pneumothorax or patient of burst abdomen. Now second priority is those who are given yellow color. As the patient comes, according to the examination, and it is decided ki after examination it is decided which priority should be given to this patient. Priority 2 is to those who are given yellow color. Yellow color is when the health condition is stable but requires close expert supervision, who require medical intervention and hospitalization. For example, minor amputations or fresh wounds, simple fractures. By giving them continuous monitoring and supervision, definitely they will survive. Now priority 3 is for color code green, who are clinically stable patients like minor lacerations and sprains, who will be, definitely they will be under observation. And priority 4, where the color code used is black, that is already the person is dead or severely injured, would die irrespective of the best treatment that is made available to them. That is priority 4. So this is how the color coding or triage is made available in day-to-day practice. Regarding tertiary prevention, specialized treatment of accident victims so as to reduce the amount of disability, provision of artificial limbs and other prostheses to those handicapped due to accidents. Then rehabilitation, training of accident victims and provision of reservations in jobs for them. As a part of government policy, reservation of 3% of the jobs for handicapped is made by government. Now, we have discussed in details about road traffic accidents. On similar lines, any other type of accident can also be prevented. What are these domestic accidents? They are falls related to injuries, then burns, electricity related accidents, accidental poisoning, accidents and injuries at workplace are the commonly occurring accidents in day-to-day practice. They are being faced by a common man. The principles of levels of prevention and control are same as that of road traffic accidents. So students, we will go through the initial instructional objectives that we had decided, and we will just check whether have we followed all of them or not. Definitions, types of injuries, intentional and non-intentional. Non-intentional also called as accidents. Magnitude of problem at world level, developed and developing countries level, India level, classification of injuries, and prevention and control of injuries. So that is all for this topic. Thank you.
sir.